CPT JJ-CPV Introduction, page 16, part 12.
Alphabetical reference index.
They're just talking about the index. We just know it as index, but they call the long name is alphabetical reference index, right?
Right.
This code book features an expanded alphabetical index that includes listings by procedure and anatomic site. So when you're looking for something, you go by the procedure name alphabetically, and if you can't find that, go by the anatomic site, where in the body it is, what's the name of the part of the body that the procedure is done. You can find it that way too. That's all it says. Now, the procedures and services commonly known by their eponyms. What's an eponym?
Eponym is
A
the
procedure
that is named after a person.
after a person, right? So it's on the name of the person. That's what it means, eponym. The name is on the person, eponym, right? And other designations are also included, right? So you have procedures that are you have to know that the name of the person, or they usually in capital, right? If it starts with a capital, it means that this is named after a person, right, or an eponym.
Right.
Okay, so that's our theory for today. Now let's do a problem. So ready, set, go. Okay, JJ-RVA-254, page 50. This is a level 2 exercise, and the title is
Laryngoscopic stripping of vocal cords.
Laryngoscopic stripping of vocal cords, and the text reads like this.
Surgery respiratory. Laryngoscopic stripping of vocal cords for leukoplakia of the vocal cords.
Okay, so that's the procedure. Now we're going to count to 3, and you can pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 31, right? 31540. 31540. Did you get that? If you got it, congratulations. If you didn't get it, let's give you a couple of tips. First tip.
Start with laryngoscopy.
Laryngoscopy.
Starting with vocal cords is a misdirect.
Yeah, you would be tempted to start with vocal cords because that's the anatomic part, right? But in this case, that doesn't work because it won't get you anywhere. So start with laryngoscopy, which is the procedure, right? The tip number 2.
Tip number 2 is a level 2 difficulty. The most common type of laryngoscopy is known as a direct fiber optic laryngoscopy. So this is a default procedure.
So this is a little terminology of procedures that you have to know. If they're talking about a laryngoscopy, they're probably talking about a direct fiber optic laryngoscopy because that's the one that is most popular. And if they don't say anything else, then that is the words that you have to look for: direct fiber optic laryngoscopy. Okay, and the number 3 tip.
The number 3 is a stripping of vocal cords. It's an operation, so look for operative.
Right. A stripping of vocal cords is also considered an operation, right? So somewhere in the way you're going to find the word operative, that's what a stripping is, operation, okay? All right. So now we're going to watch a video. First the image, right? The image of what a stripping is, right there, vocal stripping.
Yes.
In the second one is the actual stripping, right? Right here, right?
Yeah.
All right. Now we're going to watch a video that explains a little bit more of what the stripping is. Vocal cord stripping, right?
Right.
Problem number 1. Problem number 2, physician says, we need to strip your vocal cords and you'll be better. Let's listen to see what stripping does. Doesn't sound too good. Why doesn't it sound good? Well, look at the vocal cords. Now, they used to be white, and now they're nothing but scar tissue. How well does scar vibrate? Let's find out. Let's watch the strobe. So now, in addition to spasms, she can't make the vocal cords vibrate at all. We've got a problem. Well, where did this idea of stripping come from? Now, I think it came fundamentally from some findings back in the 40s, 50s, 60s, and 70s that when you stripped the vocal cord, if there was a bump there and you got the bump off, the voice got better.
Okay, so this doctor has a kind of a negative outlook for the vocal cord stripping, but at least he's explaining what it is. Whether it's negative or positive, that's not for us to decide. We just have to code it, right? But he's explaining what a vocal cord stripping is. All right, so now that, let's go back to the problem. Now that you know what it is and you know the answer, we're gonna count to 3 so you can pause the video and give us the path, how we got to the answer, okay? So 1, 2, 3. Okay, this is the whole summary of the problem. This is the surgery respiratory section of the CPT code book. And the problem is a laryngoscopic stripping of vocal cords for leukoplakia of the vocal cords. Okay, that is the procedure. Now there's only one code, and the code 1 through the index is found like this.
First, you go to index.
Go to the index.
Then you start with laryngoscopy.
Laryngoscopy, okay, and then?
Fiber optic.
We told you fiber optic because that's the most popular. It doesn't say in the text, that's why it's level 2, but you have to know that the default procedure for laryngoscopy is fiber optic. If they don't say anything, that's fiber optic. Okay, all right, and then?
Then operative.
Because it's an operation, right? We told you that already. And then?
Stripping of vocal cords.
Then you get the exact wording, stripping of vocal cords, and then you know that you're in the right way. So they give you 2 codes there, right? 31540 and 31541. So we have to go to tabular to see which ones of these is the most appropriate, right? So the code 1 through the tabular is found like this.
First you go to tabular.
Go to tabular.
Then you start with 31540.
31540, and what is that?
Laryngoscopy, direct, operative, and stripping of vocal cords.
We almost have all the words. We just find the word direct, and that is not in the text, but all the other ones are. Now let's look at the other one to see what it says.
31541 is with operating microscope or telescope.
Okay, now in this one, they don't use a laryngoscope by itself, but they have to add an operating microscope or telescope. Now we don't have that in the text, right? So that direct means that they are just taking the laryngoscope and using that for the stripping. So we have to go back to 31540, right?
Right.
So the answer is we double check the answer with the equal sign, and the answer is 31540. Okay? So thanks for watching our video, and don't forget to visit our website, and also
you can subscribe to us on YouTube by clicking here for our new medical coding videos.
Okay. So don't forget to, you will get, when you subscribe, you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
So don't forget to visit our website and also to subscribe to our videos. Thank you.
Goodbye.
Bye.